From 1750, the Industrial Revolution meant that towns and cities grew rapidly, as many people left rural areas in search of work in the new factories. This led to poor quality housing being built as houses needed to be built quickly, overcrowding as housing was built very close together to accommodate as many people as possible, overcrowding within houses as families could only afford to live in the poorest parts of towns in just 1 or 2 rooms, and unhygienic conditions with few toilets, sewers running into rivers, and no rubbish collections. Disease spread very quickly in these conditions. Chadwick was educated as a lawyer and was interested in social reform from an early age. In the 1830s, he worked for the government on several investigations, including the working of the poor laws, conditions in factories, and rural policing. He became secretary to the Poor Law Commission and in 1848 a member of the National Board of Health. He worked extremely hard and attempted to introduce many public health reforms but was rarely successful, largely because of opponents' views and because he was often rude and personally disliked. He was forced to retire in 1854. The Poor Laws stated that local authorities had to provide workhouses where those who were too old, disabled, or ill to work could live. The laws also stated that poor law guardians had to support widows and orphans. This was becoming increasingly expensive as more and more people became ill with serious long-term health issues. Many were unable to work and were dying young. The government asked Edwin Chadwick, secretary to the Poor Law Commission, to lead an inquiry into sanitary conditions in the whole of Britain. His report on the sanitary condition of the laboring population of Great Britain, 1842, found that the life expectancy of people who lived in towns and cities was much lower than those who lived in the countryside. Average life expectancy for laborers in Liverpool was just 15 years, compared with 38 years in Rutland. He argued this was because of the dirty conditions in which people lived. His main recommendations were that authorities should provide clean water, collect rubbish from houses and streets, improve drainage and provide sewers, and appoint medical officers. He tried to persuade the government that this should be done by arguing that these measures would save money in the long run, as fewer people would get ill and die or need the workhouse. The report received a large amount of publicity, but little was done.